Hello everyone, Dikshat Bhatt here this side from the team OYG. On behalf of our team, I welcome you all on this virtual platform on this another virtual talk with this another interesting person we have right now. Today we have a wonderful speaker all the way from Canada with a knack of making meaningful connection. Owen has the long history of guiding and helping others transform their health as a medical advisor, consultant, and public speaker. And the naturopathic medical graduates he mentors and educates with a dedicated passion. Owen completed his graduate and degree at the University of Ottawa while working as a clinical researcher for the Children's Hospital of Eastern Ontario. Initially, he studied the impacts of exercises on the pediatric epilepsy before transferring it to gastroenterology team. There, he worked on the projects of studying microbiome of children, including the nationwide project. Upon graduation, he found his way to the naturopathic medicine at CCNM, where he is serving as the president of a naturopathic student association. He was also part of fibromyalgia and a chronic fatigue focus shift team, a group of passionate interns looking for the help to optimize health of those suffering of chronic illness. He is passionate about using the growing fields of evidence supporting clinical benefits of a nature. As a public speaker and a consultant, he works as a corporation and organizations help to invest in the health of their employees and incorporating focus of the principles into their workspace. Owen is keen about removing the health as an obstacle to the success of his patient and strives to be the biggest cheerleader. He is here to help our community get wise about their health and the ways through which he can reflect on our best self. I welcome you, Dr. Owen, on this virtual platform, and we are lucky to have you on this board. So before I will start, I would like you to take over because even if I anything missed from introduction, you can just take over and give your introduction as well. Because it's just a little bit time and we should share. So introduction with your career was very vast, and we have just a little time to give it to the people. So.
Absolutely. Well, thank you very much for having me, and I'm excited to kind of talk to all of your listeners and all of your viewers today. The introduction was great. So I think probably maybe best to talk a little bit about my background and how I found my way into naturopathic medicine. So like you said, I was working as a clinical researcher at the Children's Hospital of Eastern Ontario here in Ottawa. And it was going really, really great. I loved my job. I worked with a lot of children with epilepsy. So I started with the neurology unit and got to work under one of the leading epileptologists in Canada, Dr. Daniela Pohl, phenomenal woman, powerhouse. And after that, I switched into gastro because my mother actually got diagnosed with Crohn's disease, which is just an inflammatory bowel condition. So a lot of inflammation in the gut. You have difficulty with eating certain foods, especially kind of raw vegetables. And so seeing my own mother going through this health condition really made me want to understand it a bit better. So I decided to apply for a different position and switched into the gastroenterology department, which was great. So we had children with, again, these inflammatory bowel conditions, so Crohn's, ulcerative colitis, and we would work with them basically and work with the families to understand the condition a bit better. So, I mean, part of that included being in the operating room and collecting biopsies or samples, tissue samples from the gut and analyzing them. So we had a really great research team who would go through and help to kind of analyze the specimens with us. And it was very rewarding, but I kind of grew disenchanted. So my mother was actually a nurse at the same hospital, and I was studying to write my MCATs, the entrance examination for a medical doctor route. Things were going really, really well. I had a good plan in mind. But then what I started to see in the gastroenterology department is that if kids were very severe, one of the medications that would be suggested to them as a recommendation would be what's called a biologic agent, infliximab, adalimumab. And they work really, really well, but they are quite potent, to say the least. So the trouble that I had was if you didn't have medical health insurance, which in Canada, we're lucky to have a public system. Others might argue otherwise, but that would cost you $40,000 a year without insurance. And that was a lot, because
Yeah.
you would kind of look at these families and you could just see the wheels turning as they thought, do I need to remortgage my car? Do I need to remortgage my house? Do I have to sell my car or my house? And it was kind of then that I decided, do I want to do this? Do I really want to have to tell people that? So it got me thinking, and I started to kind of look at other options. So I considered kind of a physician's assistant, and did I want to go into nursing? Did I want, because I knew I still wanted to work in medicine. I knew I still wanted to work with people. I love people and I love forming connections, as you mentioned in the intro. So yeah, after that, I mean, it took a turn. I went home, started researching other areas, and I came across one of the leading NDs here in Ottawa, Dr. McCrory, and she had a great practice, a thriving practice. And I just kind of reached out to her and shot her an email and said, do you mind if I come and observe you for a day? Because I need to know that this is what I could see myself doing for years to come. So it worked out really, really well. I had a great kind of introduction to her, a really good opportunity to pick her brain and observe how she interacted with patients in her own practice. And yeah, I went back to the hospital and I could kind of see, it was interesting because we did have a dietitian on staff, someone who works with the gut, works with food. Um, and the children with this condition, sometimes they would be recommended to take the medication, and then other times they would be recommended to work with the dietitian. And a lot of the time it actually worked out quite well with the dietitian, that their symptoms would go down and they would feel better. And I said, okay, so diet is obviously an incredibly powerful thing. And if it can remove the symptoms and alleviate the children's suffering, there's something to it. So I went back home. I had a big discussion with my parents about, this is kind of the change in my life journey that I'm going to be taking now. And I ended up applying for both the September intake at my college and at the January intake. And luckily I got accepted to the January intake. So that was really good. It gave me 1 month to kind of pick my life up and move to Toronto, but it went very, very well. And looking back, I wouldn't have had it any other way. So that's in a big nutshell how I came into naturopathic medicine.
It was really a great journey and great listening to. Uh, I want to ask that what skills and practices do you think naturopathy doctors should adopt for a successful clinical practice, or a particular best clinical practice? Because you have a wonderful experience, so that we can use it in our practice as well.
Oh, absolutely. I think in the question, there's a skill. So what skills can we use to adapt? And I think adaptability is probably the best skill. So the trouble that I've experienced in my own journey through medicine is that people get very comfortable with what they know. And so even if the research shows otherwise after 20, 30 years, because that's what they know and that's what they're comfortable with, they don't change their way of practicing, which can be very damaging to the patient's outcome and the patient's health. So I think one of the big things is adaptability. Because I mean, even now, if I'm seeing people in clinic, I spend a few hours researching and I'm preparing to see them for that day, and everything's going really, really well. And then they come in and they go, oh, yeah, no, that's fine. I have this totally new thing that I want to talk to you about. And you're thinking, oh, well, geez, that throws off my whole plan. Um, so, I mean, adaptability. You have to be able to kind of think on your feet a little bit. And one of the biggest reasons I was happy with choosing this route of medicine is that it gave me time with the patient. So I don't know how it works wherever, every country has their own different system of healthcare. But here in Canada, in the province of Ontario is where I'm working out of, the MDs are quite limited. So they almost have to see a new patient every 7 or 8 minutes. And you kind of think, well, how much can you learn in 7 minutes about somebody? I need a snapshot of your life in 7 minutes. I mean,
That,
we're
yeah,
probably
that's not
already
enough.
past the 7-minute mark. Yeah. And I mean, the trouble is, so I absolutely love working with my MD colleagues, with my pharmacy colleagues, my nurse colleagues, but the system is built to work against them to spend time with the patient. So I think being grateful, an attitude of gratefulness and remaining humble is good, because we recognize the shortcomings of the system, and that as NDs, we have the privilege of spending more time with our patient. So, some appointments I'll spend an hour with the individual, and that I learn so much more, because, you know, their depression that they might be experiencing, they might not need an antidepressant. Maybe they had a really, really terrible breakup, or maybe they just lost a parent to death. And so they don't need a medication for that. Potentially, they just need to talk to somebody, to work with a therapist, to work on diet. And there's lots of other approaches to make sure that their mental health is bettered. But if you only have 7 minutes with someone, it's kind of, well, here, just take that. So there's definitely times, I mean, if you have a severe infection, yeah, antibiotics can be incredibly useful, and they have their purpose. And that's where I love bridging between MD and ND, because there's so much communication that can happen there. So I definitely think adaptability, gratefulness, and compassion. Have compassion for the people who are coming through your door. They're there for a reason. They look to you for help. They look to you as the expert and the authority. And, we have spent a lot of years in school. I've been in school for 8 years, and it was quite a long journey, but I'm done now. And so for that, we are knowledgeable, but you don't want to hold that over someone. So the approach I have is one that does come from the heart, in the sense of, I just want to be part of your team. I want to be part of your care team. And how can I do that? And you involve the patient in their own care. So when you look at kind of the triangle of evidence-based medicine, part of that triangle is patient choice. But I think too often we see patient choice kind of gets pushed to the side a little bit. So I love the approach of, I'm working with you. I'm not working I am working for them, but they're not my employee, they're not my staff member. So I'm not telling them what to do. I provide options that I think, based on my experience, are best. And then it's up to them. So yeah, I think compassion, adaptability, and remaining grateful and humble.
Yeah, that's really nice, because what you shared is actually really helpful for us, that we will try gonna be like that, a doctor you need, ideal doctor we can see right now. So I
Oh,
will
I
try my
appreciate
best.
that.
I will try my best to, follow your advices. Can you share some of your experiences with working your patient? Because as in your introduction, I have read that you have worked with a fibromyalgia and chronic fatigue illness. So can you share your experiences regarding to that?
Yeah. So just for anyone watching who doesn't understand what those are, so basically at our school, we have certain focus shifts. So where you can really hone in your skills if you're passionate about a certain patient demographic. So we have a mental health shift, a sports medicine shift, and I was on the chronic illness shift, which we saw a lot of chronic fatigue syndrome. So chronic fatigue syndrome is exactly what it sounds like. You just feel tired all the time. Now, all of us have kind of woken up not feeling refreshed, or 2 p.m., 3 p.m. rolls around and we feel like we need a nap or something to help us get a little more energy. But for individuals with chronic fatigue syndrome, nothing really works to make them feel rejuvenated or refreshed. And now fibromyalgia, on the other side of that, is a syndrome of kind of chronic pain as well. So these individuals just have debilitating experiences with pain. And what's quite sad, but also shows the benefits of advancing medicine and advancing knowledge, is that years ago, they used to tell people it's all in your head. So they would have this debilitating sensation and experience with pain and just be dismissed. Oh, it's just in your head. you don't actually have anything going on. But now as technology gets better, we are actually understanding, okay, there's actual physiologic changes occurring. There's some early research even at the level of the mitochondria and being able to provide energy and things like that. So it's quite interesting to see what's come about from that. But because of the years spent being told, well, it's just in your head, these people with chronic illness come to you feeling so defeated, and they've tried this, they've tried that, they've seen every single specialist out there, and no one can quite figure it out. So they come to you, or at least I found in the clinic, feeling quite defeated or dismissed. So they're very, I think what's wise to remember is using that compassion aspect. It's important to remember that they are a very vulnerable population, and they are looking to you for help. But I do think kind of that team approach to say, you know, I'm here to be on your team. How can we do this together? It empowers the patient. They feel, for the first time in probably quite some time, a little in charge of their life, a little in charge of their energy or their sleep. So it was fantastic. I found it very rewarding to be on that shift. I found it very difficult to be on that shift because I do consider myself a very empathetic person, which works against me, that sometimes maybe I feel too connected emotionally, which as a practitioner, as a doctor, you want to make sure that you create those boundaries. But at the end of the day, we're all human. So I did find it difficult. You would leave someday feeling just, I did absolutely nothing. What did I do? Because they don't feel better. But then you'd have other days, and even if that patient, on, say they did a walk, and instead of walking 3 minutes, they walked 4, that's a huge accomplishment. And that's worth celebrating. So that's kind of where that cheerleader aspect in my bio comes about, because you just improved by, you know, 33%. That's a massive improvement. So it's celebrating the little things with that patient population that I find was so rewarding, because they kind of, they look to you, you want to be excited for them because that they made progress, and you might not track that progress by this, you know, objective standardized test that's out there, but you track their human progress, which is really important. And I think, again, that's a strength of kind of this career choice. So it was it was a very rewarding experience. I learned a lot.
Yeah, it must be difficult. I can hear from your voices. So you had a tough task, but you did it very well.
Yeah, I like to think so.
I think patient must be, you know, very satisfied with your practice and everything, because the way you express things, I think patient would be much satisfied with other doctors in compare of you. Like you did the very best thing.
I have some pretty amazing colleagues, but I definitely find taking the time to educate. And again, we have that ability because we have so much more time with our patients. But one of the 6 principles of naturopathic medicine is doctor as teacher. So it's called docere in Latin. And for that, I mean, it's great, because if you just get told what you have and no one takes the time to explain it to you, then how are you as a patient supposed to feel empowered and in control of your situation? So I love spending time with anyone that I'm working with, be it patient or just a member of the public, when I'm doing consulting or public speaking, and you educate. And it's so much fun, because then they get to ask questions, and then it's less me talking at them, and it's a dialogue. You've created a conversation. And I love that aspect of what I do.
Yeah, I agree on that part, because even I myself feel that if you connect with your patient by heart, then and only then patient will trust you. Otherwise, other doctors are doing the same thing, but they will not gonna trust them much. So
exactly.
I totally agree with you. One thing I wanted to ask is, how did you find your way to the natural system of healing? Naturopathic education you are doing. So how did you find your way towards that?
Yeah, so I think kind of the story that I mentioned at the beginning about being in hospital care, and it really was just spending time with one of the NDs here in Ottawa and seeing how she operates and how much care goes into preparing for her patient visits. And the other side of it was just seeing how much her patients responded to her, because she had worked, I mean, some of her patients she's been with for 15 years. She started seeing them her first year in practice, and now she has seen their kids or she has met the grandkids. So it's really interesting to just see how she almost becomes a part of the family dynamic to make sure everyone is feeling fulfilled and healthy. So that was a big part, again, that drew me to this career choice, was just look at how she gets to create these bonds and these relationships with these families. And again, it's a luxury of the time that we have. And I mean, that was a huge draw for me, knowing that I could sit down and take the time, because if I'm seeing, I don't know, 80 patients in a day, how much am I really going to prepare for them? I'm not. Especially if I'm seeing, 300 a week, I'm not taking the time to prepare for them. So whereas, if we limit ourselves to potentially 20 a week, well, that's a little more manageable. So I can really take time to look into things, to review their lab work, and make sure that, does anything stick out? Are there any oddities that I need to be aware of? Because if you're trying to review 300 people's lab work that has come back, you're more prone to miss things. And that's not everyone. You have some people who are very good at going through it quickly, but that's not everybody. So I think the natural way of healing was looking at the whole person. So obviously, if I have a broken arm, we know what caused that. I need to go to a hospital, get a cast attached to it, and I need to rest for a little bit. That's where acute medicine is really, really good. But, like I said earlier about if someone's experiencing depression, I can look at it as just a symptom, but I like to, and one of the principles of naturopathic medicine as well is treating the root cause. You're depressed. Why are you depressed? Let's work on this before we treat that, unless this is life-threatening, of course, if they're talking about self-harm. Yeah, but I really liked, I'm a very curious person. I consider myself a student for life. I'm never not going to enjoy learning. There's always going to be something new to learn. And yeah, so I mean, in terms of the natural way of healing, it was really interesting to me because you almost get to play detective a little bit. It's kind of, I know you're showing these 5 symptoms, but is there something that connects them all? And I want to get to that. I want to work on this to transform your health. Because one of my mentors and someone that I really look up to talks about the difference between transactional healthcare and transformation. So transactional healthcare, you come in with a symptom, I give you something and you leave for that symptom. So it's a one-to-one transaction. Whereas you think of transformational healthcare, that's where it gets really exciting. That's where I get really fired up, because we're going to transform your health. We're not just going to work on X, Y, and Z. We're going to make a new lifestyle for you. And that's where it gets really exciting. And patients get really, excited about that, because here's the first time where I'm not thinking about just today. I'm thinking about 5 years from now, 10 years from now. I want to be around for my grandkids. I want to be able to play with them and to run with them. And that's a really exciting thing, to be able to do that for people, a luxury of the time that we have for them. Yeah, so that's what drew me.
Yeah. I like the sentence you said that you love learning. I think every doctor should adopt that. Learning should be continuous to lifelong, and then and only then you will get success. So I would love that part of yours. This is a life-changing tip for some people, and like me as well.
Exactly. It's this endless kind of drive that all of us have. I think all of us as students in this profession, and anyone really in medicine, you hope that they have this thirst to learn and to gain for knowledge, because that's how we communicate with our patients and to help them improve, is just with that knowledge. Yeah.
What is the thing that you love about naturopathic medicine? What is your favorite thing?
To sum it up in one is a monumental task. I think it's getting to the privilege of playing a small part in someone's healing. So when I talked earlier about being on someone's team, I consider that a huge privilege, because here's someone who is trusting me to help them get better. And you know what? Sometimes I might disappoint them. I might not be able to help them in this current state. So, you know, maybe right now, whatever they're dealing with, they have to go see a psychotherapist, or they need to go see a physiotherapist, someone to work more one-on-one with the musculature. And I get to play a small role, and hopefully that role results more often than not in really positive, exciting moments. So like I said, you know, that example of having a patient on the fibromyalgia shift um, go from walking 3 minutes to 4 minutes, that was something that actually happened. And I left that day feeling so revitalized. And I felt this energy in me going, I just did that. I just helped do that. And it was so exciting. So I think the privilege of being on someone's team as they try and improve their health is probably my favorite part of the whole experience.
You know what I feel when you say that there is a small role of you? It's not a small, I feel, because you do the great job. The others cannot do that you are doing right now, as I can see from here. So the when patient comes to you, he will not go dissatisfied. That I can surely say from right now.
Oh, I
Your role
appreciate
is
that
not a
very
small.
much.
One
I
thing I wanted
appreciate
to
that.
ask that, you know, the researches are going on in day by day, and everything a new research is coming up. So how do you keep up yourself with the researches? Because it's
I
a tough
don't.
task.
The honest question is, I find it very difficult to keep up as much as they publish research. And I mean, the benefit is now that you do have the internet's an incredible thing. It's a very dark place in some areas, but then the amount of knowledge that gets published every single hour, it seems, is yeah, it's hard to keep up with. So one thing I think it has been beneficial for myself is choosing a way to help patients, or choosing a bit of a focus to really put my energy into. So can I know everything about every condition? Absolutely not. So is it worth my time to try and memorize everything about every condition or understand everything? No. So I actually have signed up for different alerts through PubMed, which is an amazing resource to learn about the new publications coming out. There's also a website that I love called Science Daily. So every morning I wake up to the top health news of the day and the top science news of the day. And so that's really helped me kind of narrow down what I'm trying to learn. So I try and read about two to five, depending how long or short they are, 2 to 5 research articles a day, just so, like I said, I'm doing my due diligence to stay up to date. Because, you know, if a patient comes in on a certain medication and something changed about that medication and I'm unaware of it, then I'm not serving them as best as I can. So, especially, I mean, I'm very passionate about prescribing nature. So, getting outside and how does nature impact um, the human body? So I read a lot of those articles every single week about, you know, spending time outside, or vitamin D, or having plants nearby, or even taking care of plants. How does it improve your health? So that's, don't, in terms of my advice, is don't try to know everything. It would be great if you could fit it all in there, but um, you know, it's hard to keep up, and there's only so many hours in the day. So really kind of pick an area that you're incredibly passionate about and really focus on reading the research there. Because, you know, if you don't like, I don't know, if you don't like treating cough and cold, when a person comes to see you with cough and cold, are you going to go, I'm so excited to help you? Or are you thinking, oh no, another one of these? Because again, we're all human. So you want to pick things that you're really passionate about treating, and and understanding your boundaries. So if I don't like treating cough and cold, but I have a colleague who does, go see my colleague, because they're going to do a way better job than I'm going to do, because I'm not as passionate about it as they are. So yeah, I think that's kind of how I try and keep up.
One question just arrived in my mind, that what is the first thing which attracted you towards naturopathy? Because you are so enthusiastic, and what made you attracted towards naturopathy in your life? There is some
Yeah,
incident.
I think it was, I mean, part of it started to happen when I was at the children's hospital too, because you kind of wonder, okay, well, even aspirin is so commonly prescribed, um, everything from heart attacks and beyond. But but then when you look into aspirin, it was actually synthesized from willow bark.
Yeah,
And it's so to me, it was kind of there's times when a more potent form of the salicylate might do, but if they just need some gentle pain relief, I kind of started thinking like, could they just have a willow bark tea or something like that? And so that was what attracted me, was that there were a lot of medications out there. Even one for Alzheimer's is called vinpocetine. It's a supplement, but it comes from Vinca major, which is periwinkle. And so it was really neat to just kind of see, okay, how did we go from kind of this natural indigenous understanding of different herbs, and then we identified the most active component and created a medication. And it was, well, is there a problem with using kind of the earlier form? Because now we can understand it better. We understand the safety a bit better, which is super important, to protect the safety of the public. But yeah, so I think that's what drew me to it, was kind of the time with people and just understanding that there were uses for other things out there, instead of kind of this this really quick medicine world that we now live in, which is amazing. Don't get me wrong. I The fact that we have these technologies and these medications now to help us with quick fixes is astounding, and it really shows kind of human ingenuity. But you know, I feel like we are seeing the transition towards a more balanced approach, where people do feel really empowered to kind of take on their own health. So that's really what attracted me to it in the end.
right now the current condition is COVID-19 going on the world. So, as per your experience, what would you suggest to deal with this situation? Because as a
Oh,
naturopath, I really wanted to know that how experienced naturopath would deal with this scenario.
yeah. So, I mean, we do a screening in terms of when individuals come to the clinic, they get screened for symptoms. And then right now, we're really trying to follow the public health guidelines. I mean, it's the best approach, but what's interesting is it's nothing new, right? I mean, when you look at kind of basic approaches to hygiene and to um, prevention of illness, this isn't new. Wash your hands, you know, cover your mouth and nose when you sneeze or cough. So we're wearing a mask, which is a little bit different. You wear a seatbelt when you drive to protect yourself and to
Yeah,
protect others. And so, I mean, at the end of the day, you look at kind of the controversy around mask wearing and things like that that's out there. And my mindset's kind of, well, how much has it inconvenienced me? If it ends up in a year and it comes out, well, mask wearing didn't actually do anything, who cares? Right? It didn't inconvenience me. I had to wear a piece of fabric over my mouth when I went grocery shopping. Who cares? And if it worked, great. And I know that I'm protecting myself and I help protect other people. So yeah, I mean, at the end of the day, it's just, I support my immune health, um, follow public health guidelines, and I make sure I'm eating a really robust meal and I'm getting all of my recommended daily nutrients through diet if I can, supplementation if I'm having areas where I'm just not quite getting there. Um, yeah, but for the most part, I think as much time as COVID-19 is taking up on the airwaves, nothing's different. Support your immune health, support your body's health, get good sleep. These are the foundations of health: diet, sleep, exercise. It's nothing new. I wouldn't treat it any different than um, if I was telling someone to protect themselves against other pathogens or viruses or bacteria. Foundations of health. And, if you do get sick, there are routes that you can take and there are options. But yeah, just basic support. It it helps with a lot of things.
Yeah, still, your experience would help us to guide the patients that how to deal with this situation. Because even myself, I am facing people are asking that, oh, naturopathy, what would do naturopathy in this situation? And so this type of questions, that is why I'm asking the experienced doctors like you that how to
Yeah.
answer them.
Yeah, so I tread carefully with this question just because we are trying to follow the health guidelines and really what the government's kind of allowing individuals to kind of talk on. So I think the way I would answer your question is less specific to COVID-19 and more specific to immune health. So if we just look at how do I support general immune health, then I would definitely talk to vitamin D. So what's interesting is we're starting to see early research on a potential connection. It needs to be explored further with bigger studies, but a potential connection between vitamin D and hospitalization rates, as well as severity in the inpatient units of COVID-19. So that's quite some interesting research that your listeners could definitely do their due diligence to look for. I'm happy to send along the papers that I've kind of saved or read through. Yeah, but I mean, vitamin D is a huge one, and it plays a large role in kind of joint support, right? We need vitamin D to absorb calcium from the gut and into the body. And you can get it by going outside. Now, I mean, India might be a little different from Canada. It's very snowy here today. It's very cold. I think right today it's probably minus 21 degrees Celsius.
Oh my God.
And so it's a little chilly. And but Canada, we're used to it. So I'm not going outside and tanning and getting my vitamin D. So that's one area where I might think, do I need to take a little bit of a supplement to make sure that I'm meeting my daily recommended intake of vitamin D? So because it does help with immune health. And then you look at others like echinacea is one that I use myself quite a bit of. I also really like this blend of echinacea and elderberry. And it's really curious because when you look at the research, kind of one thing that herbal research suffers from is that it is not standardized like a medication. So with a medication, you're getting the same thing every single time. And so the reason that often we see kind of these papers published that say, well, this herbal medicine doesn't work, it's because of the way that it's done. Because with herbal medicine, can you guarantee the same soil pH or same soil growing conditions in every country that you're taking the study or plucking the study out of? Can you guarantee the same rain conditions? So if there's more rain, it's going to dilute the active components in an herb. So, let's say if a company's making a product for it, do they add in more of the root or the herb or the aerial parts to compensate for that greater amount of rain? So I really like those two herbs. Those are kind of two of my usuals that I'll have if I'm starting to feel something. Vitamin C is classic. We know, there's support for common cold. Trying to think what else, but just basic nutrients. So that's why, I mean, even in terms of vitamin D, why I love prescribing nature to patients, right? So, hey, get outside half an hour every day and make sure that you're exposing yourself to sunlight. If you do find you're a little sensitive, make sure you're wearing your SPF to protect yourself from the sun. But there's just so much good research about spending time in nature and outside that there's no downside to it either. Who are you going to prescribe a nature walk to and they're going to go, well, I'm worried about the side effects? Nobody, unless you have really bad allergies, of course, then you take steps to treat that. But there's not really a side effect to prescribing that people get outside a little bit more. So I love doing that.
Naturopathy medicine has a very much, treatment facilities and all the different kind of treatments in the naturopathy medicine. So among them, I want to ask is which one is your favorite?
Oh, I am definitely biased towards diet and lifestyle interventions. and botanical medicine. I love working with the herbs. I really like making the tinctures to kind of create a blend that's very unique to the patient. And that's another kind of going back to your question earlier about what drew me to naturopathic medicine. It was that it really recognizes it's not a one size fits all approach. So the tincture I make for, say, a 47-year-old female with I don't know, diabetes, is going to be very different from a 47-year-old female with diabetes who's maybe, I don't know, 50 minutes less active a week. And just that one small factor kind of changes my approach to how I might work with them. So it's, I really like the individualized medicine side of it. And that's where kind of diet, lifestyle, and botanical medicine really lets me thrive, because everybody eats differently. And diets suck. If you tell someone, I need you to cut out this, 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 and this, maybe 1 in 100 people will actually do it all. But people like their carbs, they like their bread. So if you suddenly try to take that away from them, they're going to fight you, or they're not going to come back. So I like the challenge of diet, because you kind of see, okay, how far can I push this person before I get a little bit of resistance? And so I really like working with substitutions. It's kind of, what about that food do you really enjoy? And can we find another way to find that same enjoyment without totally taking it away? I mean, you know, one of the individuals I'm working with really enjoys their kind of daily pop. That's okay, right? Because when you look at, if that's the one kind of vice that they have, I'm not going to take that away from the individual, because they find enjoyment in that. Is it the best choice for them? No, but it's something that they enjoy. And when you look at everything else they're doing pretty well. And even when you look at the results coming back from their blood work, if they're doing really, really well, their cholesterol is in line, everything else seems okay, are you going to take away the one kind of a semi-bad thing? So you work with them. And so I find working with diet a very fun experience. And I mean, especially with the global pandemic and the lockdowns, people have had more time to cook. Restaurants, obviously we want to support our small businesses, but when they weren't open, a lot of people were going, oh, well, I order out every single day and now I have to cook for myself. And so you saw a lot of learning, and again, they gained knowledge, and as the doctor working with them, you can now educate them and have a conversation and a dialogue. So yeah.
Last question from my side. Do you have anything, suggestions or tips or anything you want to guide us? Because all the aspiring doctors are listening to you right now. So do you want to guide them something, on any suggestions, tips you want to give us?
I would just encourage them, remember that it's okay to not know everything, because you won't. Remember that it's okay to have a day where you leave your clinic or you leave work and you just feel so defeated and you're thinking, I didn't do anything. It's okay to have those days. We all have them. And that it's important to prioritize your own health, because how are you supposed to help somebody heal if you're not in a good place yourself? So it's okay to step back, for a little bit of time to really work on yourself. And you're not abandoning your patients, right? If you need to take an extended period of a break, then pass your patient along to one of your amazing colleagues. But definitely work on yourself and just self-love, be compassionate and be kind. When patients walk through your door, you have no idea what they're coming from, where they're coming from, whether they're rich or poor. It doesn't matter. At the end of the day, everyone's human. You're going to treat everybody the same. Just respect basic human decency and be kind. I think, I'm really trying to, one of the things I'm practicing in the new year is not really trying to read less of the negative news And now I follow a whole bunch of positive news channels, and they only report positive stuff. And I mean, I don't watch them all the time because it'll skew my perception that everything's okay and sunny in the world. But you know, you hear a lot of negative stuff, and so I think it's good to just remember to be kind, treat each other with kindness.
It was really a great advices you gave us, and we will definitely try to follow that. So, you know, it was really a wise session for us.
Oh, see, it's catching on already.
So thank you so much, Owen, for joining with us, and we would really like to see you again in our future. If we can meet
Absolutely.
it personally, then we would love to meet. And if not, we can get you on again on this virtual platform. Thank you so much for giving your time. And it was a lovely session. Nice talking with you. So,
oh, my pleasure. And yeah, if I ever find myself in India, I'll definitely make sure to connect with OYG and the whole
you are
group.
Welcome in India. We would love to, you know, welcome you and show you the Indian beauty.
Oh my gosh, I'd be honored. And yeah, if anyone has other questions and they want to reach out, they can just go to my website, which is owenwiseman.com. So spelt exactly like my name. And if anyone has questions, I love them. I love communicating with people. So otherwise, to all of you, please keep healthy, look after you and your loved ones, and I look forward to connecting again.
Thank you so much for giving us your time, Owen.
My pleasure.
Bye.